Foundation, Chairperson, First Ladies Against Cancer. So over to you, Doctor.
Good morning.
Good morning, ladies. Your network has bounced off my guest now.
Oh,
we're sorry for that.
On. There she is. There she is coming back on now. Good morning, everyone. We're about to start our session on on Kakaaki Cancer Awareness. Can you hear me, Dr. Zainab?
Indeed, I can hear you, Denise. Good morning.
Okay, good morning. Good morning, and thank you for joining us. So let's kick it and let's talk about the issues with cancer in Nigeria. So welcome everyone to another edition of the Kakaaki Cancer Awareness hosted by AIT in partnership with Kakaaki Cancer Foundation. I'd like to thank you all for joining us this morning as this particular episode has been called Let's Talk About It. So today we have in the house Her Excellency, Dr. Zainab Shinkafi-Bagudu. Thank you, Your Excellency, for being here.
Thank you for having me.
For the purpose of this, do you mind, how do you want me to address you?
Whatever makes you most comfortable, Denise.
Okay, so we'll just go with our normal, our way we do our things. Okay, so thank you very much. So ladies and gentlemen, let's sit back and listen to what Dr. Zainab has to say to us this morning as we enjoy and listen to what issues are that are going on in the cancer space in Nigeria. Her Excellency Dr. Zainab Bagudu served as the First Lady of Kebbi State, and she's the chairleader of the First Lady Against Cancer, board member of the Union for International Cancer Control, that's what we call the UICC, and works as a consultant, pediatrician, and advocate to improve women's health with a particular focus on cancer. That's very, very, that's, I have to, well done. Let's keep going. Faced with poor knowledge and challenges of cancer patients in Nigeria, Dr. Zainab founded Kakaaki Cancer Foundation in 2009 to increase awareness, build human resources capacity, fund diagnosis and treatment of cancer in Nigeria. Through this and many other platforms, she has worked passionately to build partnerships and policies that increase access to quality care, management, and research in sub-Saharan Africa. So with her experience in building these partnerships, a lot has changed. And today we are privileged to have her. She has worked in the medical space, which you will more appreciate is very important when we talk about this. She has worked in the medical space for over 16 years. We thank you with this particular interest in cancer. Thank you for joining us this morning, and we look forward to us having a really good chat about what's going on. So I'm going to start now. We have a lot to talk about. So let's start with a lot of things that people are talking about, and then we'll take it as we go along and see how we go. So you were in the front seat in advocating for this catastrophic cancer fund that's now called the it's now called the Cancer Health Fund.
Yes.
And it's strictly, the budget is strictly towards cancer and breast cancer, cervical cancer, and prostate cancer. However, implementations have been slow, and there has been some misgivings expressed about the transparency of the selection criteria. What role are you playing to ensure the smooth implementation? As you are aware, I have actually continually talked about this on the platform, trying to say, please, where's this money? We need it. We need help. Vis-a-vis making funds available or accessible to all of us. I'm not an exception whether I'm in England. So we are. You are the doctor. We are the patient.
Yeah. Okay. Thank you for that question, Denise. It's the Catastrophic Health Fund, or Cancer Health Fund, as you rightly say, it's now called, was a fund that was advocated for by a group of very active people and organizations in the cancer space, pharmaceutical, civil society, even some governmental bodies, the NHIS were all involved, And eventually the fund the legislature was very important. There was a lot of lobbying so that it could be appropriated into the budget properly, create a funding line. Now, when the fund was finally approved, it was domiciled in the Federal Ministry of Health. The Federal Ministry of Health went ahead to set up a committee that is made up of experts from civil society, which I represent, of course, members of the ministry, and also scientists, professors in our universities. The chief medical director of one of the hospitals represented that interest. And the idea was for us to adjust the way in which it had been structured by the advocates led by Health Federation of Nigeria that actually saw the implementation or the actualization of that fund. The reason why, and the first one that was approved was just over about 730 million naira. It has taken a long time to start implementing, we agree, but we had to get it right in the sense that who are the patients that are going to benefit? Are you going to give patients just for one sum, or are you from one round of treatments, or are we going to treat them for all through their disease? Are we going to treat late stage cases that are really just requiring palliative care? Or do we take the early stages? So a scientific committee was put together to oversee that. Then there was the ICT component. A consulting firm was hired, EMG, to sort out the implementation or how it was going to be structured. How do people apply? When you say that it wasn't very transparent, I think that this is a conception because the site and the how to apply was made very public. I participated in it. My foundation was one of those that helped to disseminate the information. But when you put it in context, Denise, and you think about 700 million naira and the burden and the expense of treating cancer, how many patients can you actually treat with that amount? I'm not saying that the amount was not enough. It's not enough, but it was a start. It's meant to be a seed fund where the way we designed it initially, it's a seed fund where all sorts of funders can pool in and increase. But that part of it hasn't been pushed so much. Everybody is relying on that initial 700 in the 2020 budget. Now, it has actually started being implemented. Cancer patients applied on their platforms and their e-wallets are credited in the hospitals where they are receiving treatment. So you will find that there are patients in the National Hospital Abuja, University of Ibadan, ABU Teaching Hospital. There were 7 pioneer teaching hospitals that were picked, and the hospital welfare verifies that this patient is indigent and needs the funding. Now, some of them have been lost. Unfortunately, some died. Some is very difficult to reach them, knowing the way that our system operates. People come from hard-to-reach areas to the teaching hospital for treatment, or they lose their phones and they don't use the same number again. They're not versatile with their emails and so on. But to answer your question, the fund is being implemented as we speak. There are patients that will testify that they have received sums upwards of 2 million naira in their e-wallets in the teaching hospitals where they are receiving treatment. As for transparency, I think that we need to publicize more the steps that are involved in applying and the eventual disbursement of the fund. But it has been a very bias-free process. You couldn't bring your patients, even I from our NGO, no, they had to be patients of the hospital that are receiving treatment in the various teaching hospitals. So I think that's the best answer I can give.
Certainly, no, thank you. Thank you. Sorry. Thank you, because you actually have
publicizing all the steps that are involved. But sometimes publicity is not a strong point of government structures. To be honest, the way we had wanted the fund to be structured was to be like a sort of public-private partnership implementation, so that you and I could bring our patients from our foundations, because we are the ones that are in contact with these patients daily, not at the level of the federal ministry. But that was along the line. Unfortunately, government doesn't work like that. And at the end of the day, the funds belong to the nation, and there has to be a line ministry in charge.
Thank you. No, it's one of the things that is very important to ask, because when it's a conversation that is going on, it's best to always get information from the source than for us to continue to speculate. I know a few people that applied for it. I don't know how far they got, but I do know, and there are some referrals that we also made. So, yes, I know it's started to go up, but I needed you to answer this question so that the general public could know what.
I know, yes, there's a lot of agitation from the public, but if you notice, it has died down.
Yes.
The ministry were called to the House, the the Federal House, the House of Representatives and the Senate, and they faced the committee, and they were able to make the process faster, and it has started. And at the time it started, there was an announcement.
Thank you. Okay, now next question I'm going to ask you is, can you talk briefly through your experience, because there's something I'm going somewhere with this, your experience over the years the changes you have made or seen as a medic, as a CEO of an NGO, Medicaid, as a FLAC member, as an advocate for cancer. I'm going to focus, everything is about cancer today. So awareness in Nigeria. Can you talk us briefly through your experience with the changing trends from when you started 16 years ago?
Well, the first thing I would say is definitely awareness is increased. There are lots more civil society, people that are interested, creating this much needed awareness. For us in low middle income countries, Africa, Nigeria, the greatest problem that we have is awareness. Most of our patients that you find in the hospitals receiving care are actually late stages. We do not have regular screening or routine screening programs. For instance, in the UK, a woman at a certain age automatically gets a call-up letter to come in for treatment, to come in for screening. However, when this is not available, the disease just evolves, and people tend to find alternative forms of treatment before they present in the hospital. So awareness was poor, but that is gradually increasing. On a daily basis, I get messages on my telephone talking people seeking for help in navigating the system, help in funding their treatment, referrals, and so on. So this tells us that definitely the awareness is increasing. And if you talk to the oncologists in the hospitals as well, they will tell you that they're seeing more early stage patients, which is good. We also have been able to include better policies from the government at the governmental level. At the end of the day, the health burden lies on the government to make and implement the proper policies that will help to improve cancer control. A cancer control plan was developed. There is a national committee steering it, which I sit on as well. And the funding that we're talking about, aside from this, there's also a chemotherapy access program, which is a partnership between pharmaceuticals, the government, and various other organizations, through which drugs for chemotherapy are given to patients at a reduced pricing. Again, that is available in the teaching hospitals and some non-teaching. In Kebbi State, it's available in the Federal Medical Center and the state's highest hospital, which is the Calgo Medical Center. So the chemotherapy access program is available there. It's implemented by CHAI, and you find it at less than 50% of the cost of what the patients would normally pay for it out of pocket. So that is a great step forward as well. We have better policies. And I think by far the most important is the inclusion of some degree of cancer care in our health insurance scheme, both the state and the national. We're able to access some screening, some surgical, some chemo, as well as radiation assistance through those that have national health insurance coverage. At the end of the day, universal health coverage is the only way that we're going to be able to institute better access to care for cancer patients. Because, like I said, and like we all know, care of cancer, treatment of cancer is extremely expensive, and it's not a burden that we can place on people to pay out of pocket. Even the most well-to-do can easily get bankrupt from treating cancer.
I can tell you that I agree.
Yes.
I think that is it's a shame that it's a shame that we actually have to go through that. And I think it's the biggest anxiety that a cancer patient faces globally. And yes, we're talking about the treatment, but actually there's a whole section of their mental well-being, finances, everyday life. Because I had to retire before I was 50. And that already tells you that, gosh, a lot of the income I was supposed to earn has gone. And that happens to a lot of cancer patients. So yes, hopefully with small steps and with the determination of people like you, we will get there. I'm very hopeful. So I'll keep talking about this until we make continue to make our milestones. I'm going to ask you another question now. What is the UICC? And what role, you're laughing, and what role does UICC play in raising awareness for cancer, particularly in Nigeria?
Okay, UICC is the Union for International Cancer Control. It's a global body consisting of over 1,500 members spread over 100 countries of the world and different continents across board. It's a cancer community that aims to bring together advocates of cancer, cancer patients, families of cancer patients, to advocate for better care, convening, education, and generally improving policies and building capacity around cancer. There have been many organizations that have spun off from the UICC, an 85-year-old organization. In Nigeria, I would say that one of the things that we've been able to achieve is the fact that I sit on the board of the UICC. There have been observers that were on the board of the UICC before me, but I was the first African to be elected onto that board in 2018. Okay. So that was an achievement in itself. And since then, there have been lots of capacity building. There are some ongoing programs, which I can't talk about, through which we're hoping to bring better treatments to Nigeria, access to treatments, access to radiotherapy. The City Cancer Challenge Foundation is a spin-off of the UICC, and it exists in a few African countries, Rwanda. We have it in Kumasi, Ghana, and of late, Kenya was also enlisted. So these are the kind of programs that the UICC runs. There are lots of online and physical capacity building sessions through which education awareness is increased and people get to know more about it. So in summary, that's what the UICC does. Of course, it's involved in grants in that sponsor awareness programs. We have been beneficiaries, as indeed have many other organizations been beneficiaries of UICC funded programs that aim to improve the life of patients. The One Call Away program that was co-funded by Pfizer and implemented by Medicaid is a support program. You were talking about mental health. Is a support program for patients with metastatic breast cancer that we were able to secure a grant for and offered the psychological support, following them up on a weekly basis, almost working with the oncologist so that they could have a better mental health and through that improved outcome with their treatment. It's a formidable body. I like to call it the WHO of the cancer space. If you think about what the WHO does in health, and you zone the health down to cancer, and then you zone down the organization and the overall bodies down to the UICC, then it gives you a better picture of what it does.
Okay, you see now, I think it's important that we all understood that, because I think we're all aware, at least the cancer space is aware that you are in a bid to become the next president of the UICC. For all of us in the space in Nigeria, it is important for a change, for there to be an African leader. And I think you guys have had to go through not coming down from numbers to coming down to who are the last two or last three that can contest for this role. And you've been fortunate to be able to get to the finals now. So now that we're at the final page and we in the cancer space, and that is, when I say we, I talk about the medics, all participants, because the cancer journey is not about the patient or just the medics, or it's about the whole community in Nigeria. Now, what can Nigerians expect of you? What are you bringing to the table now to make a difference? And I'm stepping out from this because I do know quite a lot of the things you're doing, but I think you need to educate all of us. And there are things I'm sure I do not know about that would make a significant difference.
Okay, like I said, the UICC is the global body with over 1,500 members. Some are full, some are associates. Full members are over 500. In Nigeria, we have 22 organizations that belong to the UICC. This was greatly increased since I joined the board. Initially, there were just about 5 full members, but today we have 22 members that are full members of the UICC. If we expand it to Africa as a continent, we have about 79 members. So the rest of them are all spread in different countries of the world. I would like to say that my bid for presidency and being shortlisted is an indication that the Global South is increasingly being listened to, and the need to have us at the conversation table where vital decisions about cancer policies are being made. It's remarkable and something that we must mention, that in its 85 years of existence, an African has never led the board of the UICC. Now, if I am elected president, my goal would not be to do things for Nigeria. It would be more to close the gap that exists in cancer. We need to be heard, but we need to also learn. So bringing and taking out. There's always this conception that low middle income countries are just taking handouts, but we do have a lot of pockets of altruistic givers. It's almost impossible to go into any village in Nigeria where you cannot, and you would not find that when someone is sick, the community gathers around to care for that person, no matter how little, in whatever form it is. And these kind of givings are not captured. There are also a lot of foundations that are not regarded as international foundations, like the Commode Foundation, like our Medicaid Foundation, and so many others that are supporting cancer patients. Again, that is not captured because they're not CHI or UNICEF or all the other Gavis and Bill and Melinda Gates. We don't have that kind of funding, but we have the experience and we have the knowledge of what happens in our cultural context and again in our economic context. So what we can do is to ensure that that gap that exists between the high, the middle, low income countries is bridged in a way, and people like myself that have been exposed to both worlds are able, I believe, will be able to do that better. I have vast experience in global policy, global cancer control, as well as, of course, my own national, and when you zone it down to Kebbi, at the very rural level in the most hard-to-reach areas where we organize screenings, treatments, and so on. That enables me to bring on board that experience. So that's the key thing that I think that we will be able to do, to listen, to have conversations that are meaningful. And let us break this conception that, oh, we just need to take. We take, but we also give, and that bridge can be gapped. In terms of convenience, definitely by joining the UICC, there are a lot of benefits that organizations can get, and I'm hoping that the Commodus Foundation is also going to join very soon. Just by being on the board, we've been able to increase the strength and power of Nigeria as a sovereign nation. There are also various opportunities that exist, and we'll be able to, let people know about them better if I am on that board. There are quite a few things. Awareness at the rural level, capacity building for our scientists, clinical trials I haven't even touched. So many trials are going on all over the world that don't require funding, and we just need to include patients. And the largest country in Africa is not being included in the clinical trials that are going on all over the world. So opportunities like that can be amplified more and people to know about them better.
You answered 2 questions in one, so you just saved me a lot of time trying to work out what to do. I want to really thank you, because you have not just shared for the general public, you've shared for the medical, our cancer space, but also for the policies and the changes that we're expecting to go forward. And to be honest with you, we really, I think as the Nigerian population, we would really wish you all the best in this bid, and we trust that hopefully you'll cross the line and we will have a voice in the cancer space globally going forward. On behalf of Kakaaki Cancer Foundation, AIT, thank you for sponsoring this opportunity for us to have Her Excellency Dr. Zainab Shinkafi-Bagudu. I have to always get this right. You see, going to school with you makes it very hard whenever I have to talk. You can also... yeah, it's very hard because I'm like, what name am I calling you here now? You can follow us all on Kakaaki Cancer Foundation, and you can find everything we've had to talk about on the Medicaid site as well today. Subscribe to any of our platforms, both Kakaaki Cancer and Medicaid, and click on the share button, share information, because as we will say, awareness makes a big difference in the cancer journey for all of us, especially we stakeholders. We don't know what to do, but we learn from the medics and the professionals and those who are in the places of policy that make a difference for us. So you can find us on any Instagram, Facebook, or YouTube, websites. Just check LinkedIn. So just check and you will find information on both of us. You will find it and you'll be able to see what is going on and what you can partake in wherever you are. But lots are going on. So thank you. And to AIT, we want to say a very big thank you for partnering with us and making this a very seamless experience, because cancer awareness is key to us making a difference in Nigeria. So thank you very much. Thank you, Dr. Zainab, Excellency, for joining us.
Thank you for having me, and thank you to the team at AIT. I must say, they have through the years supported us by amplifying programs that have to do with cancer, and we really appreciate that, and we ask for you to keep on doing it and doing much more.
Thank you.
All right, thank you
AIT
so much.
Answer.
Of course, we're answering Dr. Dennis, doing great job there.
Yes.
Cancer awareness is key. And Your Excellency, hearing and listening to you, doing great job also in creating this awareness is also quite interesting. We appreciate your time, and we are happy to do this with you, because education and awareness is key, like you said.
Thank you.
Thank you so much, ladies. I think Dr. Zainab is an amazing doctor. I think in terms of creating cancer awareness, I think in last March she had a walk creating awareness for cancer, and she's doing an amazing work in the community. Quite a great job there, for